Good, and welcome to the Nebraska Speech Language Hearing Association's webinar to prepare you for the 2016 Legislative Day. Thank you for joining us this afternoon. Ms. Janet Saloff. I'm the Executive Director for the Association, and I am going to give some very general instructions on how to participate in today's webinar, and then I will introduce our three presenters, and they will then present lots of information to help you prepare for our upcoming event. To video of today's program, you have two options. You either listen through the speakers on your computer, or you call in using the phone number that will display on your screen. All telephone lines have been muted. We also have a chat feature that's available to you today to post any questions or comments that you might have. To use that feature, go to the upper right-hand corner of your screen and on the area that says chat. In that box, you can simply type in your question or comment, and from the drop-down list, choose whether you'd like to send your question or comment to a specific person, to all presenters, or to all of the participants. And then we've made that determination. Simply type in your question or comment and hit the send button on your screen. Our presenters today are Rich Lombardi with American Communications Group. That is a lobbying firm in Lincoln, and the NSLHA contracts with to provide lobbying services and support. Our presenter will be Cindy Johnson. She is NSLHA's Legislative Affairs Committee co-chair and is an audiologist who is employed at Children's Hospital in Omaha. Our third presenter will be Jessica Taney. She is also NSLHA Legislative Affairs Committee co-chair and is a speech-language pathologist and owner of Alpha Rehabilitation in Kearney. So I want to thank our presenters for joining us today. And at this time, I am going to turn over the presentation to Rich.
Buddy, thanks for being on today's call. I want to start out with a quote that's particularly relevant for all the folks on the call. If you always found yourself in organizations and look around the table and say, well, it looks like we have the same people here, or that at various levels of frustration of why didn't we get more people to turn out, and it seems like the same people are doing the work. We really enjoy this quote from world-renowned international anthropologist Margaret Mead, who has found certain truths in her study in anthropology, whether it's the Samoans in the archipelago in the Pacific or the exec board of the Nebraska Speech, Language, and Hearing Association, that they never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And we get to see this work out on a fairly daily basis within organizations, certainly within the legislative body. And I think one of the things that's really important about this is that my experience at UNO 2 weeks ago just really affirmed once again that when people have the experience of what you're about ready to take people through down the legislature, have that interaction. If done this before, they really discover the power in themselves, and they see the power of the collaboration. And I think that's an ongoing lesson that we need to have as our thread as we bring students and others down to interact down at the state capitol next week. So, and I think this is true in all of your lives, because you're all a bunch of activists to begin with, that there's a core group of people that really make things happen. And to that end, I really thank you for being on the call today, and we will try to do just a very brief overview of the legislative process. I am stealing from a friend of mine Fred Knapp, who is a reporter for the Nebraska Educational Television Station, he had about a minute and a half, 2-minute video the other day just on how a bill becomes a law. And Janet, I think at this time I'd like you just to play it because he covers a lot of the points in it. It's very informative and it's very short. So, Janet, you run that. That was a nutshell, I thought, of legislation and how to look at the bills. What I want to go to now is, you know, that you live in a state with an internationally unique state legislature called Nebraska unicameral, a one-house legislature, nonpartisan, and this is, as you know, truly a unique institution. And there is a process by which the laws have to follow through that are different than any other civics lessons about the House of Representatives at the national level, the Senate at that level. So, what I was this was basically a flow chart of how a bill moves through the legislative process. And there are certainly a number of steps. I think as Fred talking, an idea comes up, a bill gets introduced by a state senator. The first thing that happens is that there is a committee of leadership of the legislature that decides what committee has jurisdiction to hold a public hearing on this. Now, in Nebraska, every bill that's introduced has a public hearing. A lot of states, that's not true. But the bill that's introduced, and we introduced 434 of them during the first 10 days of this legislative session, gets assigned to a committee. And that committee then is responsible for scheduling the public hearing. And a lot of you have been to public hearings. You know that they take proponents, opponents, neutral testimony. And the committee goes behind closed doors and decides on whether or not they advance the bill, they do nothing, whether they amend the bill. The media gets to watch that, but that's a closed setting. The committee itself is an open setting, but they get to decide what that bill, whether it continues to proceed through the process, and which bills get advanced to the full legislature for their debate. And And that a bill advances from committee to the first stage of debate where the entire legislature deals with it is known as general file. And this is where all 9 legislators get to debate it, get to amend it, they can kill it. At the end of the day, if they choose to advance it, clearly what the Nebraska Unicameral has created is a series of redundant steps, repetitive steps in the deliberation process. So assuming that your bill gets out of committee, assuming that the bill gets general file and they debate it and a majority of senators, 25 votes, remember, make you right, 25 votes advance that bill to the next stage where it gets debated all over again. This is called select file, where the legislature can debate it, amend it, kill it, advance it, or sell it out if they want to, all that. That's all repeated on select file, assuming that the bill meets the majority rule in that particular stage. It goes to what's known as final reading. And this is a place where sometimes when you've come down to the legislature, this is where the legislature is almost like locked in there. They can't come out. They can't talk to any citizens. They have to sit at their desk, and the bill receives their final vote. And then at that time, if it's you can't do any more amending on it. It's not discussed. You either vote it up or down. If you need to make changes to it, you have to have a motion to say, I need to move it back to select file for a specific amendment, and they would vote on that. I mean that it's at the stage of final approval. Then it goes to the governor. The governor can sign the bill. He can let it sit on his desk, and it will become law without a signature, or he can veto the bill. And if he vetoes the bill, the legislature then can take it up and override his or her veto, and it will take 30 votes, not the 25, to override veto and make it become law. If a bill passes and is signed by the governor, it will usually go into effect about 3 calendar months after the legislature adjourns. So, like, we're going to adjourn supposedly April 20th. So any bills that are passed this year that don't have what's known as an emergency clause will go into effect 3 months from April 20th. If it passes with the emergency clause, which is a much higher standard, I think you have to have 33 votes to do that, they'll go into law immediately upon the signature of the governor. That's the process of the bill through there, and one of the things I want to share with you is all the very, very good communicators, and these are just some rules of thumb. I know they make a lot of sense. They're common sense. But I think they speak to the type of posture that we want all of our advocates and all of our members to do. And I think, every time I talk to students and others that come through the process, they always get a little amazed at. I think during our UNO discussion, there was a nervousness about coming down there and talking to senators. Says, well, geez, I really don't know anything and everything. And then they started talking about their profession, which they were particularly informative about, and the legislature was very intrigued about and understanding what they do as an audiologist, what they do as a speech pathologist. So part of the posture for everybody coming down there is that, one, you're an information source. You are an expert on your areas. Legislators are not necessarily experts. They have to be almost Renaissance people because of the multitude of different things coming their way. The obvious thing is always, to tell the truth. And as you're going down there, one of the questions you start getting asked by senators is, well, who else supports your position? Who's on your side? Who doesn't support your position? And know who the opposition is. These are all big fundamental things if you're entering into a power relationship and attempting to do policy advocacy. Those are two questions you really need to know. The other that is very, very real is that and we've talked about this before, there are not 6 degrees of separation in the state of Nebraska. There's 1 degree of separation. As we dig down into our relationships, we find that we have a number of members that are connected. Either they're related or they know the spouse of a particular legislator. They went to school with the son. There's a lot of connections. If there is a connection like that, you want to use that in your discussion. Use the point of Cindy Johnson. We're on the phone. We're talking about a problem I'm having with Speaker Flood, and she brings up the fact that she offices next to him when she was up in Norfolk. And this just, again, tells you that there's a lot of important connections out there, and it's very helpful in your advocacy that you do that. I think difficult things for people is to admit that we might not know something, and frankly, what I kind of encourage that. Part of what we're doing here is we're building a long-term relationship. We want to have opportunities to follow back up with legislators, and so, Senator, I don't know the answer to that, but let me get back to you on that. It gives us a really nice follow-up that we can do. I think things go down there. We have a lot of emotions with an issue. We want to talk about it, but really, when you're in a communication with legislators, you need to be specific of what it is exactly that you want them to do. You want them to amend this specific law, or you want them to support this specific bill. You got to be really kind of specific about it, and not go through. Go through some of your feelings, but not all of your feelings about that. Obviously, we're always attempting to. This process never ends. Once you start getting involved and you're in the river of public policy, you will forever be involved in following up with legislators on various issues. From time to time, these issues, you're going to get pissed off. And you really need to contain that because your enemies one day are your allies the next. If your enemies 1 minute become your allies the next as we switch from different bills. So you don't want to do any burning of bridges. But in the final analysis, in a democracy, citizens are the boss. And you need to have some confidence that you are the boss and that you need to take those responsibilities as a boss to inform the public servants that work for you what you and your colleagues believe are important. So I'm going to stop there, and we can go into other bills, but I think what my goal was just to try to do a brief overview. I'd be happy to answer any questions, but that concludes my part of the presentation.
This is Cindy Johnson, and I'm going to talk to you all about bills. Like Rich said, we had over 400 bills introduced for this legislative session, which is a short session this year, but that doesn't mean that we don't care about all those bills, but not all of those bills affect what we do. And so one of the great things that American Communications Group does for us is they help monitor the bills and look through them. Rich and his staff read through all of the bills, at least they say they do, and they let us know which bills affect us. So they look at which bills could affect our licensure or how we are reimbursed. A lot of us work in education, and so they look at those bills that affect education and educational services. They look for the bills that will affect our patient population. So for me, it's pediatrics. For some SLPs that work with stroke victims, it's those folks. And then it changes to the tax code that could both negatively or positively affect what we do and those we serve. And then each week, Rich's staff forward a list of the bills that we are monitoring to Janet, and then she posts those on the NSLHA website, and she also emails that out to the membership. So we try to keep all of our members informed of which legislation we are monitoring, what are we supporting, what are we opposing, and we invite our members to weigh on that. In fact, we want to hear from our membership on which bills affect how they do their job or how it affects their livelihood. So that thing about having American Communications Group working with us to monitor that, because we all work full-time. We don't have time to read through all the bills, and they do a fantastic job of doing that for us. So the bills, and there are many, but we're going to talk about basically 3 or 4 today. bills that NSLHA is supporting this year. Next one is LB 1013, which is an increase on cigarette tax or the increase on tax on cigarettes and other tobacco products. So this will reduce the number of new smokers, cancer deaths due to smoking, and reduce a lot of money spent on health-related problems that are related to smoking. Just healthcare professionals, we want people to stay healthy, and so we are supporting this bill because it will affect people greatly. And Janet has information, so if any of you want some other specific information about all the dollars and the numbers, we can get that specific information to you. Just let us know. Next one is LB 1032, which is the Transitional Health Insurance Program Act. This will allow federal Medicaid dollars to be used for eligible people to purchase private insurance. So this is going to give more people access to our services. These are the 77,000 Nebraskans who are working, they're poor. They either have part-time jobs or they're working part-time and going to school part-time. They work for places that don't offer health insurance. They make too much money to qualify for Medicaid, but they don't have money to purchase individual health care at the cost that comes to us. This bill will allow us to get the money we're already paying in from our taxes to the federal government and let us use it for our residents of Nebraska. And so we are supporting this bill because thing to do. And I'm using Rich's words. It just is the right thing to do. And Rich, if you have anything to add on that bill, I would welcome your comments.
No, I think you hit this bill is interesting. All these years that we have that we try to get money in various budgets to expand special ed or to help with different types of health care. This situation where money has already been set aside, you have already paid through your federal tax bill, as all of America has, into a fund, and the state of Nebraska has to choose to utilize it. So it's not like there's going to have to be a new source of funding. There's actually $250 million available on an annual basis for these 77,000 working Nebraskans. And unfortunately, over the last couple of years, we have chosen not to take advantage of it. The legislature, majority of the legislature is supportive, but we've had successive governors that are resisting it. This particular year, we have some new leadership in the legislature that are carrying this, and they have actually done some reaching out to places that you don't usually find support these types of programs, and one of those places is the corporate business community of Omaha, which is now beginning to weigh in favor of this bill. There's a huge coalition of folks on this bill. Both of these bills that Cindy talked to, there are huge coalition efforts that are afoot. There is some momentum behind both of these bills, and the addition of your organization in that advocacy is quite significant. So these bills are very much in play. They are very close in votes, and any and all help that we can provide to it may make actually the difference.
And it's a really important, the time now is important to find out what our connections are. So if any of you coming to Legislative Day, if you have a relationship with a senator, even if he's not your senator, if you know the person, reach out to them and talk to them, and you'll have that opportunity when we're in Lincoln next week. So it's just critical that your voice needs to be heard, and they listen to us. That's the important part that I think we sometimes forget, is that the senators actually do listen, and their staff listen. The next bill is Legislative Bill 706, and I'm going to let Jessica talk about this bill.
Hi, this is Jessica Taney. I'm going to be talking about LB 706. We have identified this as a key bill for the reason that it could impact reimbursement and also access to service for the people that we serve. So we've looked at this bill and we've identified it as just a key bill. I had the opportunity to attend ASHA and go to the meetings. I'm also a part of the STAMP and STAR committees for ASHA and kind of the liaison between NSLHA and those committees. And there was a lot of talk about habilitated services and coverage and what that means and what that looks like. ASHA has actually devoted kind of a new task force to be able to help states kind of differ what the laws are and how to advocate for this. So we've reached out to ASHA. We're using some of the information that they've given us as we kind of move forward on this bill. So LB 706 defines habilitative services for the state of Nebraska. Habilitative services means healthcare services that help and keep, learn, or improve skills and functioning for daily living skills that include applied behavioral analysis, a way that the bill reads. Kind of identified some problems with the language, and we're going to try to reach out to maybe some other associations because the way that the bill reads doesn't necessarily match up with the full definition defining habilitative services. So we have a little bit of work to do on this bill, but we do support need to define habilitative services. The federal bill has identified it includes OT, physical, and speech therapy, as well as psychiatric rehabilitation and a variety of outpatient and inpatient settings. So you can see that kind of left out of this bill in the definition of this. So we're looking to maybe see what we can do to amend this a little bit to include that. ASHA's recommendations are also to make sure that audiologists recognized as part of this bill. ASHA has some specific language that they recommend, and I've given you a link here, and I really encourage everyone to go here. This is the essential coverage, rehabilitative, and habilitative services and devices pamphlet that ASHA has put together. I think they spent a lot of time gathering information and data and really looking hard at this topic so that they can inform all the members on the best practice and what we should be advocating for. I've actually requested a bunch of copies of this pamphlet to be at our legislative day. So hopefully you have those, and if you don't get a chance to look at the link, maybe grab one and quickly read over it. But it really helps us define, understand what habilitative services means. There's a lot of really great case examples in here of how it's defined and how each practice serves different areas. Just really encourage you all to look at that bill. Rich, do you have anything to add on that?
I would recommend exactly what you're suggesting is that people should be familiar with that. Those of you that there's a thing called what this is speaking to is a term that we've talked about before, and that's what's known as the essential health benefits that are going to be under the Affordable Care Act in Nebraska going forward. And they use what's known as benchmark insurance plans. Blue Cross Blue Shield has a silver plan that's become the benchmark plan. And for those of you on earlier calls when we were talking about cochlear implants, we found that cochlear implants were actually covered under the new benchmark plan. And this is important because it applies to health insurance plans inside and outside the exchange of the healthcare exchange in Nebraska. And so what's attempting to be done here is to make sure that the essential benefit plans going forward have habilitative care services included in it. So I would commend you to read the background information on this particular proposal, and we kind of line it up with what is in the silver plan of Blue Cross Blue Shield right now.
Sorry, I was going to say, if you want to access those plans, too, you can go to the CMS website, and there is a section, and you're able to click on Nebraska and view those benchmarks as of now, and then those benchmarks are going to change a little bit and what is going to be changed for 2017. You can access those benchmarks on the CMS website.
I know this sounds a little confusing, but those are two good resources and to give you a better feel of what's being attempted here. But
yes,
very important bill.
Go on and just go to the next slide of habilitation versus rehabilitation. And kind of what Rich was speaking to is the Patient Protection and Affordable Care Act, which requires all non-grandfathered health insurance plans on small group and individual markets, both in and outside of the marketplace, to provide those 10 essential health benefits. Rehabilitative and habilitative services and devices is just one of the required categories. So I think especially for the students, it's really important to kind of understand the difference between rehabilitative and habilitative and what that means. And so I've really outlined the definitions here. Rehabilitative is services or devices that help a person keep, get back, or improve skills and functioning for daily living that may have been lost or impaired. Maybe they were sick, hurt, or disabled. Again, this definition also includes physical, occupational, and speech language services such as audiology and for disabilities in a variety of inpatient and outpatient settings. So it encompasses a lot. And from a speech therapy standpoint, this is where you talk about your stroke patient. This is where you talk about your patient that was in a car accident and suffered a TBI. Those true rehabilitation cases. And then into habilitation, which this covers services that improve functioning of daily living, help them keep or learn new skills. And, you know, and the biggest example we have for speech is this is when we get those children who are not talking, unexpected, not hitting those milestones. And this definition outlines that this may include physical, occupational, speech language, and audiology. I think the same categories, persons with disability, and that we can do this in an inpatient or outpatient setting. So I think when you understand differences between rehabilitative and habilitative is going to be key when you're talking about the LB 706. So, and I was going to turn it just to Cindy for a little bit. She can just maybe give a couple of examples the audiology side of what a rehabilitation patient looks like versus a habilitation patient for audiology.
Okay, this is Cindy again. So for audiology, when we talk of rehabilitation, we're really talking about maybe an adult who had a head injury and now they have tinnitus, so their ears are ringing, and we're trying them with that. It's very debilitating for some people, and so we can, and we have devices that can be for that, but there's also therapy that we can do. So that would come under a rehabilitation, as opposed to habilitation, which is, again, with a child, maybe cochlear implants. It's a good example of habilitation for children, or even newborn hearing screens, when we do a hearing screen. And we need a hearing loss, and we're fitting them with hearing aids. That comes under habilitation for audiology. So again, it's if you keep in the back of your mind that rehab means someone lost a function and that they want to get it back. Habilitation means they probably never had it and to get it. So that's how I think of the difference between rehabilitation and habilitation. So it's a kind of simple way of thinking of it.
I think that's excellent. I think that's a great way to look at it. And again, if you look at that link with the essential coverage, it really goes into depth of talking about the differences and giving case examples. So again, please just refer to that and have those handouts available at the legislative aid. So Cindy, I think I'm going to pass it back to you.
All right. We have one bill that we are opposing at this point, and that is SB 900. This is a law that would repeal the motorcycle helmet law, and the bill has been introduced in the past, and it's not ever gotten very far, but now the senator who's introduced it has also added something extra, and he's going to establish a motorcycle safety and brain injury trust fund, and to fund this by charging the motorcycle license $19 more. That'll go to that fund. And just again, from a healthcare standpoint, this is a terrible idea that the $19 isn't going to come close to covering the cost of the medical expenses for the people who are injured because they weren't using a helmet. And we're going to see a larger number of traumatic brain injuries as people are going to choose not to wear a helmet. And so just from a health perspective, we're opposing this bill. And again, Rich, if you have any other, well, this is also a coalition. There are many other groups who are also opposing this bill. So we're going to be working with other groups and just lend our voice to also oppose this. But Rick, if you had anything to add.
Sure. This bill has a public hearing next week. We will, in this particular case, we will submit a letter in opposition to the bill. Because this bill has advanced from this committee before, we're anticipating that it will again. The senator that introduced this bill, this is his last legislative session, has made this his personal legislative priority, which is likely means that it will be debated. We succeeded last year with a coalition of folks. Hilkeman from my area led our efforts to do a debate on this bill. Although we talk about it in the earlier, you hear the term filibuster a lot. And basically filibuster is nothing but extended debate. However, in the Nebraska legislature, it sets if in fact there is extended debate going on, to stop that debate and to vote up or down on the bill, it requires that there be 33 votes. I've mentioned before, 25 votes make you right, 30 votes you can tell, the legislature can tell the governor where to go, but it takes 33 votes to shut up. And that very high standard, it's much more than the majority. So what we're doing with the Medical Association, hospital, and EMS providers, and just a myriad of other groups that we're telling stories like that of people that work with injured people from motorcycle accidents and the traumas and what we need to do to try to avoid that as much as possible. So we will be involved in assisting with extended debate, and hopefully when the time comes for cloture, that we count on at least 17 senators, hopefully more, that will reject that. And if the senator doesn't get to the 33 threshold, the bill would be dead for the session. So it's headed for kind of the showdown at the OK Corral, but we are trying to have many conversations with legislators about people that we have all worked with that have unfortunately had significant injuries, or families that have had deaths in them because of motorcycle folks not wearing helmets.
Rich. Really quickly, Rich did a nice job earlier of giving hints about talking with senators. I thought of a few other things. So just really quickly, first of all, just remember that talking to the senators, they are people too. They put their pants on one leg at a time, just like we do, and they want to talk to us. So Senator so-and-so, but they're still somebody's grandpa, somebody's dad, somebody's mom, somebody's sister, and they're very approachable. That's probably the biggest takeaway I had from the first time that I attended a legislative day. It was like, oh, they're scary, and I don't know why I thought they would be, but it's just a thing when you get to talk to a senator and you know they listen to you, and be what you said helps the vote. So just remember that. We do want to be very, very respectful. It's okay to agree to disagree. Telling stories is probably the most important thing, and just like Rich said, if you know someone who didn't wear a helmet or lost a family member because they didn't wear a helmet while they were riding a motorcycle, tell them that story. Those stories are what make things real. If senators do start to get off on tangents, and sometimes that happens, or we get ourselves off on tangents, you got to kind of remind yourself and remind them that, hey, interesting, but let's get back to what we were talking about before, because we do need to make the most of our time. We're probably only going to have them there for half an hour or so, maybe 45 minutes, because now and I'll be telling you this in a bit, but the line is changing to a different location, so we might have a little more time with them. We'll see. You want to smile and be happy. We're happy to be there. If they have a loved one or a friend or someone else they know who has received your services, tell them some success stories, how patients' quality of life improved, how that saved money to the state or for the family. And then invite the senators to come visit where you work. I know we've had many senators come visit us here at Children's. They don't do until we tell them. So it's really important. Invite them to your clinic, to your school, workplace. A lot of times they'll say, oh, yeah, I'll come. So invite them to come see what you do.
Okay.
Now, that's you, Jessica.
I just want to, again, just like Cindy said, kind of echo off that this is really our opportunity to showcase who we are and what we do and why what we do is important, and just really outline the areas that impact. And so I learned, and I've learned this, and I know the students coming out will learn this. I am a speech pathologist that works in private practice. I work in hospitals, nursing homes, more medical side. I run into this all the time. And even at Legislative Day last year, talking with one of the senator's aides, they just really didn't have the understanding that we worked in all these other settings and we had all these other skills and services that we offered. So just kind of clear up that perception and just, yes, we have we have a large amount of people that do work in the school, and you can talk about the services they provide, but also try to hit on to some other areas that we work and that we impact swallowing, that we work with cognition, that it's not just a school-based profession. We have researchers. We have people that are out there researching best practice and all these techniques that we're using to make the quality of life for the patients we serve better. So really emphasize your training and talk about what it takes to be a speech pathologist, your clinical trainings, your school internships. Talk about that you have the ability to treat all these other things besides just the child that has a speech or delay. Just the light just kind of went on. Oh, really? I never knew you worked with patients that had traumatic brain injury. That's interesting. And so really out there what we do. And again, it's not just children. We work with infants or children and infants. We work with elderly people too. And so focus on some of those other areas and talk about the training that takes and kind of inform them on what is a speech pathologist. So go to the next slide. And again, we're in an age where, budget is becoming an issue and cuts and costs and cost savings. And so really talking to the senators about why our service needed. What do we do? And I like to talk again about diagnosis and all the patients that we can help. I listed out some, just for the students, just to kind of remind them. I know ALS has been in the news so much with the Ice Bucket Challenge and, really talking about some of those diagnoses that, that are very common. And I didn't list on here, which was a big one, Parkinson's. Probably talking, you will find someone that has a loved one, has a grandpa, has someone that has had a stroke or has Parkinson's or has had a diagnosis over time or a traumatic brain injury. So really talk about those things and what we can do to impact them, memory, organizational skills. I like to try to stay away from the term we all like to use executive functions, I don't know if they're going to understand that. So really keep it simple and say, we can really help people return to work. We can really help, babies that are in the NICU transition onto a bottle to get them out of there faster. Really talk about the functional outcomes and the functional gains that people are seeing because of our services. And within that, we know because of what we do that there is a long-term cost savings. Advancing skills, we're allowing people to return to work faster. We're eliminating extra costs. For instance, a patient that maybe had a feeding tube and we were able to transition them to oral feeding. So really talk about all this stuff all these skills that we have that in the long run improve the quality of life for the people that we serve and increase their independence. Also on ASHA's website, if you want to look up, again, some evidence-based practice, even if you have some of those statistics kind of in your mind that speech-language pathologists, in serving traumatic brain injury, we've seen gains in memory of almost 81% of the clients had improved, attention, 82%. So you can look up some of those evidence-based practice numbers on ASHA if that makes you feel more comfortable before heading into there. But just like I said, a lot of those numbers are good, but really bringing it back down to the personal stories. Just a very quick one because I know we got to get going, but I had a patient that was heading to spring break from college and was involved in a motor vehicle accident, traumatic brain injury. Was at Madonna, was in a coma, went through the process, came back, was an outpatient, improved his memory, improved all of his executive functions, improved so he was able to return within a year back to his college and get enrolled in his classes and do normal life. Those are the stories that they really want to hear, and I think that will really have that lasting impact on why what we do is important. So again, just really focus on how we enhance the social, emotional, educational areas of people's lives. So I just take this time to really brag upon what we do and how we can make a difference in people's lives. Anything to add to that?
No, you did a great job, Jessica. We'll be there together, and I think we have a really large group of people, so I'm excited.
And Cindy and Rich, this has been great information. I'd just like to wrap up with a little bit of information about logistics and what to expect on Legislative Day, and we'll get to the questions that have been submitted in the chat feature. First of all, if you are able to join us first thing on the morning of Legislative Day, we'd have as many people as possible meet us outside the Norris Legislative Chamber. That's where the legislature meets, and we'd like to meet there at 9 in the morning, and we will go upstairs into the gallery, which is the balcony, and at some point the speaker will recognize the group that's there and recognize that its initial is Legislative Day, and it's a nice opportunity to have some additional visibility and recognition from the senators. After that, we will go downstairs on the main level by the information desk. There will be a display set up with some handouts and poster, and that is intended to provide information to anyone who might be in the Capitol that day. Those handouts will also be distributed with some thank you gifts to the offices of all of the senators, the governor, and the lieutenant governor. And I thank our student organizations for putting together those gifts. My understanding is that will include bottled water, koozies, and a set of earplugs, and information that helps inform them about the services that audiologists and speech-language pathologists are providing. There will also be a fact sheet about the association that will be included in those handouts. So if anyone is available to help deliver those items to the offices, we'd love to have all of the help we can. It's also just another great opportunity to meet either the senator, if they happen to be in their office, Likely they won't be. They'll be on the legislative floor, but occasionally they might be in their office or to meet their staff. And I want to mention, too, that sometimes the legislative staff attends the luncheon, and that is great as well because those are the folks who are doing the research on the bills and the issues, and they're often the people who are keeping the senators very informed on different issues. So it's very important, too, to connect with them, to build relationships with them, and have them be allies as well. Once we've finished with that, we will go to room 1023 for the program in the Capitol. This map that's up on the screen also has been sent to you in an email so that you can have that handy and bring that with you to help navigate the halls of the Capitol. Room 23 is where we'll have a short program. Cindy and Jessica and Rich will be there again just to do a quick review of the issues and provide some fun talking points and tips for everyone. And then at some point between 11 and 11:45, Senator Sarah Howard will be coming to speak to us. She's on the Nebraska Legislature's Health and Human Services Committee. She's a great supporter of many healthcare organizations and very insightful and a strong leader in the areas with the unicameral. And you may have, if you were at Legislative Day last year, you would have heard her speak. Always delightful to meet with, and I know she'll be happy to entertain questions that you might have. So I think you're in for a treat to get to listen to Senator Howard. And we had planned to go across the street to the governor's residence for lunch. However, the governor's residence is able to accommodate up to 64 people. We have currently 69 members registered for Legislative Day, and then 2 senators and their legislative staff. And because we have such a great turnout, space is not large enough, we are actually going to just have our lunch in room 1023 at the Capitol. So we'll stay in that room. We'll have lunches brought in for everyone. The space might be a little cozy, but that's okay. It will certainly give us plenty of opportunities to have extended conversations with the senators and their staff. So please stick around for that. Also, I wanted to mention that the students have put together a really fun contest. A number of them have created memes, and certainly we want to encourage all of you to take a look at those. They'll be posted on February 2nd on NSLHA's Facebook page, and we will be sending an email out to everyone who's registered for Legislative Day, as well as all members, inviting you to vote and to like whichever meme you feel is your favorite. And you have 24 hours to vote. The votes will be cast and by February the 3rd, and then the students will award a prize to the student who has the most likes with their meme. So I think that will be a very fun contest, and we appreciate all the time and the creativity the students have put into this and everything that you're doing in your student organizations to promote participation. We have right now 51 students coming to Legislative Day, and that is just fantastic. So congratulations to all of you and your faculty for all of your efforts and being involved in advocacy with the association. Also, student organizations are designing buttons that they'll be wearing, and I think that's a great way, too, to have visibility and catch the attention of senators and their staff and other visitors to the Capitol that day. So thank again to all of you for your great efforts and promotion with Legislative Day. I was asked also to talk just for a moment about parking around the Capitol. Unfortunately, sometimes parking is a little challenging. There are usually 1 hour and 2 hour spots right around the perimeter of the Capitol, and then there's residential parking available. Also, the Cornhusker Marriott, which is just a couple of blocks from the Capitol, has a parking garage and then there's another parking garage right across from the hotel. So those are also good options for you. I would encourage you to arrive as early as you can, because once legislative hearings are underway in the afternoon, there are lots of people in and out of the Capitol, and parking can become limited. So if you have questions, please feel free to send those to the chat, or you can call us at the office or email us, and we'll be happy to help you. And we want to have a great experience and be as prepared and comfortable as possible. With that, I think we'll move into the questions in the chat. We have 3 submitted right now, and I'm going to combine 2 of them together because they kind of go hand in hand. And Rita, if you don't mind, I'm going to direct these first 2 to you. So the 4 bills that were discussed today, the question is, what's the status of those bills as far as are they with committees right now? Have hearings been scheduled? And secondly, do we know any organizations or others that might be opposing those particular bills?
The bills that have been talked about today are bills that have been introduced this session, and public hearings will be scheduled on those bills going forward. The question about, yes, there'll be public hearings. The oppositions to 2 bills, I mean, clearly the tobacco industry, and then the tobacco industry has a number of have own quick shops, and those items get a lot of money for the marketing of tobacco products, so they always figure prominently in leading opposition to the tax proposal. There's a conservative think tank that doesn't like taxes, named the Platt Institute. They will be in opposition to that proposal. With regard to the insurance transformation issue, this unfortunately has gotten, we're a nonpartisan legislature. We have a number of folks that are registered as Republicans, and this has unfortunately taken a turn to be a very partisan issue. The states that have chosen not to expand or utilize expansion are usually states that are governed by a Republican governor. And although several Republican governors have found ways to work in this area, our biggest opponent and problem is Governor Ricketts on that particular proposal. With regard to habilitative care, we are hopeful, given the fact that, historically, we've had challenges. We've always done battle with the health insurance industry, but currently, the habilitative care definition and what is covered in essential health benefits, particularly the Blue Cross Blue Shield Silver Plan, has most everything covered except for, and that's why applied behavioral is added to that bill. There's a specific exclusion in the current essential benefits benchmark plan for applied behavioral theory, and that's why it's mentioned specifically there. I don't think this bill is going to have a big fiscal note, since supposedly right now the essential benefits are to be covered. Going forward, that's been a problem in the past. That bill, like I said, all these bills, if they haven't had scheduled hearing on them, will have a scheduled hearing. But I do think that the opposition on the bill has to do with the extension of Medicaid to working folks. You have the governor being the major opponent on that, and senators that are within his own party, and certainly the tobacco industry in particular, and their various minions will be fighting the other bill.
In terms of the status of these bills, right now for LB 706, the Habilitative Services Bill, a hearing has been scheduled for next week on February the 9th. And the association is working to have a person testify at that hearing. LB 100 on the motorcycle helmet bill has a hearing scheduled for next week on February the 1st. And as was mentioned earlier, the association will be sending a letter. LB 1013 on the tobacco tax right now is with the Revenue Committee. And the 1032 on Transitional Health Insurance Program is currently with the Health and Human Services Committee. And you always watch emails every week. We do send updates from Rich's office to the membership and also post the updates in the member portal on the website. So those reports give you updates on when the bills do advance from committee to the legislature for debate or if they stall out, and that's the end of the process. So that's a good way to stay informed. You also can go to the Nebraska Legislature's website at nebraskalegislature.gov, and there's a place where you can type in the bill number, give you the description of the bill, and we call that introduced copy, and then we'll also give you all the dates on as the bill advances there too. That's also another good way to monitor the status of the bills. Ask whether the slides from today's webinar will be provided. Yes, they were emailed to everyone in advance of the webinar, and we will send another copy out to everybody to make sure you do have that information. Looks like we have one other question in the queue, and that has to do with a question that came in about legislated insurance coverage, and if that's passed, concerns that it would limit fee-for-service for private practice audiologists, and challenges right now with reimbursement for Medicaid services, and wondering, why should support LB 1032 given those challenges that exist?
The levels of reimbursement are very real issues. I think the probably fundamental reason is that in the healthcare education profession, there's probably a commitment to serve people that are in need. The 77,000 working Nebraskans who are, was explained before, that are deprived of being able to access health insurance are certainly a group of people that, if in fact the transitional health insurance is expanded, will have a degree of options that they don't have right now, and it's a myriad of health services, including your own, would be available. Does it solve the problem of appropriate reimbursement? That is an ongoing challenge, but I think that the use of having people that are working for a living have access to health insurance. We know for a fact from studying UMC that if you have health insurance, that people don't have health insurance die at a higher rate. This is about saving lives, and notwithstanding all the challenges of inadequate reimbursement for services, saving lives kind of trumps those particular problems. So that would be my answer.
I would add, too, that these are folks that are not going to come with private dollars to be able to afford hearing with some kind of insurance coverage. So, that's a different battle. And our insurance committee, we're working with the HHS and working with them in terms of coding and reimbursement. The conversations that we need to have at some point is about reimbursement and the levels of reimbursement. But in this case, this is giving access to just overall health care for folks. And if buying private insurance with these dollars, it may not necessarily be with Medicaid coverage. So they may be able to purchase a Blue Cross plan, and it may have a hearing aid benefit. We don't know. There are some unknowns, but again, I agree with what Rich says. This is just to give people access to actually having health insurance so that they go to the doctor and get basic health care needs met. Only right now, hearing aids, they're not really considered a basic health need for a lot of folks, except for children, and that's wrong too. But that's a whole different debate. I think that's my personal opinion, but it's a good question, and I agree. I was in private practice. I get that. It's hard to pay the bills. You're getting paid, or not. You're not getting paid enough to pay your bills. It's hard to stay in business. So it's a real question.
I have questions in the chat right now, so I will just ask Rich, Cindy, and Jessica if you have any final comments or bits of information you'd like to share.
We're just excited for Legislative Day, and we're happy that we have such an excellent turn. We're excited to see everyone there.
I echo what Jessica just said. I'm really looking forward to next week.
And I got what those two said. Look forward to seeing everybody down here.
If anybody has questions, they can certainly pass on to Janet, and she can pass them on to us, and we can get back to you before next week as well. So don't be afraid to shoot a question, even if you get off the phone now or off your webinar and you think of something 3 days from now. Ask a question. Just get Janet at the NSLHA office, and she can get it to one of us, and we can get an answer back to you, because we want everyone to be armed and dangerous to come down. So, thanks, everybody.
Thank you all.
Thank you for your participation today. For those who joined us live and those who are listening to the recording, we look forward to seeing everyone next week. Have a great evening.